We live on a beautiful planet, the planet that provides us everything, everything that we want, or is it everything that we need? Food, clothing, shelter, and of course, medicines in the form of herbs. This is Aware and Care, a beautiful weekly program brought to you by Santhigram Group of Companies. Ayurveda is a traditional form of medicine that originated in India thousands of years ago. Its approach is holistic healing. And of course, when you talk about holistic healing, we have the holistic healer in the house, Dr. Ambika Nair, co-founder and chief consultant of Santhigram Group of Companies. Namaskaram, Doctor.
Namaskaram. Thank you.
The series of Aware and Care has brought a lot of interest and curiosity and lots of questions from our viewers. A topic that is very dear to many parents and of concern. When I said a topic, well, the topic itself is atopic dermatitis or atopic eczema that is popularly known as.
Okay.
Many parents have written to us, many parents have texted us to talk about atopic eczema. We want to know today, from Ayurvedic perspective, what is atopic eczema?
Atopic eczema, it is an immunological disorder actually.
Mhm.
Okay. And it is seen, it starts, in Ayurveda we call it as Vicharchika. Actually, it comes under the Kushta Roga.
Mhm.
Even in Chanaka Samhita, it is written very well. But normally it starts, some children are born with that, but normally after 6 months the onset comes.
Mhm.
Onset comes means the whole family will be affected because it starts on like a small rashes on the body and it start itching
Mhm.
and even on the folds of the skin, especially on the like with the hand folds and at the back of the legs, and even it comes on the under the neck. The
All right.
itching is so terrible. The child will be so restless, crying. Some days oozing will be there, dryness will be there because this is
Mhm.
all according to the constitution.
Uh-huh.
Okay, if it is kapha related means, kapha means little chubby children. Okay,
Mhm.
so that the skin become very thick with that,
Mhm.
and like itching will be there. And if it is like pitta means more, like bleeding will be there, but itching will be there in every case. And vada means excessive dryness and itching
Mhm.
and restless, very restless. Child will be like running around on the, like moving around
Mhm.
during the sleep, even, very difficult situation.
Mhm.
That's why
They say about they say
it
about
is
15 to
affected by the whole
20% of
family.
children are affected by this skin disease. And
Yeah.
we started talking about it's a childhood disease. So, how early can a child be diagnosed with atopic eczema? Is it immediately after birth or after a few months that a parent should notice that the child has discomfort? Because when a baby is born, the initial few days and months, the child has scaly skin, the skin is forming. So, it is very difficult for anybody to understand the child actually is born with this or he or she has developed it after birth.
No, the rash starts developing actually.
Hmm.
Actually, by the, like by 6th month, you can see the rashes. This is not the normal rashes, which is very
Hmm.
itchy, scaly. Some days oozing will be also there. So
Hmm.
the child is so restless, start crying and all. Then only the people will understand there is some problem with the kid, and
Hmm.
they take to the pediatrician, and the pediatrician will be telling them, referring them to the dermatologist, and they will tell that, oh, this is like atopic eczema or
Hmm.
atopic dermatitis.
Hmm.
That's why they will understand it.
Dr. Nair, atopic dermatitis eczema can start very early as per this conversation, as early as
Okay.
6 months or maybe sometimes earlier than that. The first
Yes.
instinct is to take your child baby to the pediatrician. And most popular thing which comes across is cortisons or steroids that are given to the baby to calm the baby first, and then start the next step of the process as to start observing what is the cause of this eczema developing so early. In your experience, what are the reasons a baby so early, so young develops eczema?
See, I have seen that the parents with the asthma,
Hmm.
and even the like some cases I have seen there is a history of skin diseases in the family.
Hmm.
Okay, and even genetic disorders are there. Some other genetic disorders are there, like kidney diseases
Hmm.
and even a hormonal imbalance. This all I have seen in, like in cases. and asthma, and even very common, I should say.
So this is more of an immune disease
It is an immunological disorder, actually.
disorder. It is an
Yeah,
immunological
and
disorder.
yeah,
So what is the process of treatment for a small child as early as 6 months, and till what age does eczema be prevalent? Can it be controlled or cured?
it can be controlled and taken care. Actually, like when the small children will come, like when they are breastfeeding, so we will not give the medicine to the child. Actually, through the mother, we will administer the medication.
Mhm.
So, like we will be telling the mother to take the, like where thick medicines are there, like it means very bitter medications that will be administered to the mother. So through the mother, the child become all right.
Mhm.
So as they are like even more like 8 months or 9 months like that, then we start giving like one drop, half drop of the decoctions, so
Mhm.
that along with the milk and all they will give.
Mhm.
And external application is also given to a very small child.
Right. So
Oils are there, very
uh this is for
we
mothers
are
who are breastfeeding. But what about mothers who are bottle feeding the baby? Do you give them the medicine through the milk in the
yeah,
bottle? Or that's
we will give the medication to them through the milk only.
Mhm.
Yeah, then
I see a question which often comes up, that this is a part of food allergy also. Is there a stream related to atopic eczema?
yeah, because actually what you eat, that is that we call it as the causes. Ahara
Hmm.
hetu, what you eat, like virutahara, you will be taking like because some people will be taking garlic with the milk,
Hmm.
and like marshy food,
Hmm.
like even any like even so much of consumption of like shellfish in the family, the mother must have taken or the father must have taken. So all these things, that we tell them not to take like that.
Okay.
Then like proper food, it should
Hmm.
be a wholesome food. It's not like like some people are very particular in eating. They won't eat. Whenever we say that you have to change your diet, what you
Hmm.
are eating is not the wholesome, it is not nutrient, like then we have to make really difficult, like because it's very difficult to make them understand. Then
Okay.
they will change it because the child is suffering. When the child suffers, the whole family suffers.
Right.
Then their habits. Actually, not only in like 1 year or 2 years, because it can, if you don't take care, it can go to the adolescent also, even throughout your life also you can.
Oh.
So that is the, like a vihara. What is your habit?
Hmm.
What type of habit is, whether you're sleeping in time, whether you get up in the morning, whether you work out, means how is your day going,
Hmm.
how you react with the people, because like a 6 year, what is your, like mental status, this all comes in that.
Hmm.
Then comes, achara. So that is, that is inside you.
Hmm.
That is the real mental status. How you behave with people. That is
Okay.
more important actually. But
Hmm.
like when this is a Vada Prakopana also. So when the
Okay.
Vada is extreme, because children become very irritative, they get
Oh.
mad
Hmm.
because you cannot tell them, because actually I know that how the 90% of the children come with wearing gloves.
Oh.
Okay, because they otherwise they will be itching. So, but
Itching.
when
Yes.
they grow, like a 6 year, 5 year until they will never listen. They will remove it. They will itch, and
Hmm.
itching means it will be bleeding, and fissures will be there. Too
Hmm.
much, like deep cuts will be there. It will be oozing, bleeding will be
Hmm.
there. I,
Hmm.
like because the children, when they go out to play and all, big inferiority complex in them. This I
Oh.
have seen.
The social
And
life gets affected a lot for the
so
child at
yeah,
that age.
because other children will tell them not to come and play with them. They isolate them a lot.
I think this is a good time for you to let our viewers know that this is not a contagious problem. It is just an individual child or an adult who's facing this. It is not at all contagious. Am I
Yeah,
right?
it is not a contagious at all. It's not at all contagious actually.
Not at all
Because I
contagious.
know they will come, and because the people will come and ask, no, you give a letter that
Hmm.
they can go to school.
Ah.
Because actually, so they are forced to use the cortisone ointment.
Hmm.
They use it actually, moisturizer, all those things, because they use it. Otherwise, they will, even moisturizer, it will not work. And antihistamine to suppress the itching,
Okay.
allergies.
Uh-huh.
So these children, either they will be like asthmatic also, otherwise
Oh.
they will become. See, if the skin is worse means the asthma will be better. If the asthma is worse, skin will become, means better again.
So there is a correlation there.
Yeah,
Okay.
this is like the elder sister and younger sister. They
Okay.
are there only.
Mm-hmm. So, Dr. Nair, when this is atopic eczema that we are talking about today, so are there different types of eczema? Is there something I've heard terms like contact dermatitis or
Yeah.
just for the scalp? Does it affect a specific part of the body or it could affect any part or the types?
Atop- Atopic eczema means, because it is seen on the skin folds actually,
Mm-hmm. Mm-hmm.
because then it is pressed to the body.
Okay.
Okay, because it's starting is only because like that on
Mm-hmm.
the in the skin folds, especially in between the like the knee,
Mm-hmm.
under the knee.
Mm-hmm.
Okay, so that you can that itching will be there, and because very the discoloration like a bluish discoloration will be there. There are so many types of atopic, like eczema also. But
Mm-hmm.
eczema is a different topic. Atopic eczema is entirely different actually.
Entirely different topic. So
Yeah,
there is a
because
difference there that
actually,
we should be addressing, right? Okay.
yeah.
So,
And
from an Ayurvedic perspective, let's get to what is Panchakarma therapy and how does Ayurveda come in place for any child who is suffering from atopic eczema? What are the steps
Madhavi, when
involved?
they come, we will ask whether the child is coming in contact with any chemicals,
Hmm.
whether any, like whether wearing any what type of cloth they are wearing. These are all more important actually. You
Okay.
understand?
Uh-huh.
So that we will make them understand that they should not wear any nylon or anything like that.
Hmm.
And the Panchakarma treatment, like I will tell you, uh, if the child, because according to the age we do the panchakarma. If the very small age, well, I already explained to you what we will be giving them to the family only. Okay. If like 2 years, like that, 3 years and all, we will be doing, like a sarvanga dhara.
Hmm.
Sarvanga dhara means it is a medicated way of we mixture it with the buttermilk, and we will be pouring the medicated uh, stuff on the body. It's like a dhara, continuously pouring. Then afterwards we wipe them off, and again we do with the oil
Hmm.
massage. Okay, that is an abhyangam, mild abhyangam we will be doing. So that, like after few days, like we have done a lot of cases actually. It is very common here.
Hmm.
So after few days you can see the rashes goes away. And before that itself we prepare them for the panchakarma also. We
Okay.
will see that whether their digestion is okay, whether the child has any breathing issue. If the breathing issue, we will not do that. First, we
Hmm.
will see that the child is perfectly all right to undergo the panchakarma.
Hmm.
Then only we will do this. Okay, then what we do, like Virechana will be done,
Hmm.
some medication also will be given, some diet restrictions,
Hmm.
what they should take. It's very difficult because when we tell the child not to take any chocolates and all, they will look. Don't know what is best actually, itching or getting cured.
Oh,
But children understands actually better.
yes.
Yeah.
Uh-huh. So, how much does the weather play a role in the treatment? Is there a specific weather time when the child should get treatment, or this treatment can be given anytime throughout the year?
No, because actually here we can give any time
Okay.
according to the severity of the, because if it is very cold also, very hot also, and if it is because of the humidity also,
Mm-hmm.
some days aggravation will be there. And
Mm-hmm.
like use of cosmetics, all these things, like it makes a lot of changes.
Mm-hmm. And what about stress factors? Does it trigger it more? I mean, anybody having stress and
Yeah.
atopic eczema, is there a correlation between the two, the
The
bouts?
child will have actually the stress is given to the parents.
Okay.
Because when
Mm-hmm.
the child is very small, there is no stress for the child because the only thing he will be itching.
Uh-huh.
That's all. But the stress is seen in the parents actually because they cannot sleep. The child will come by crying.
Mm-hmm.
Because this is seen in so many times, they will come and tell because the child does not sleep. So they will give some medication for the child to sleep actually.
Really? Oh, okay.
Yeah,
So this is a cycle here. I think when you talk about
it's a
atopic
cycle. It's
eczema,
a cycle.
that the itching itching increases that, and itching also gives a relief to the child, that temporary relief. But it is also that it increases, inflames it. The family members are not able to sleep, so the next day, there is a spillover effect of stress on everybody, and the child is definitely absorbing that. I'm sure most of the parents who are watching this understand the cycle here and will try to break that. Let's also get to some dietary restrictions or any foods that you recommend that these children should have to start, making them feel comfortable or make them calm.
We first of all we tell them, like if the child should not be given any mamsa actually,
Okay.
especially chicken, poultry. We stop
Mhm,
them,
mhm,
and shellfish.
mhm,
99% they will be vegetarian only.
mhm,
But some children will forcefully, like we cannot say, they will tell that they are not taking, but we understand that. We see
mhm.
from the tongue, like then
Right.
what they are eating. Because we'll be
Mhm,
monitoring them daily. It's a daily
mhm,
assessment, how the child will be doing it.
mhm,
Okay. Then, like buttermilk will be given to the child. But if the child is asthmatic, then we will not give the buttermilk.
mhm,
Okay. Milk, because very small kids, very difficult. Almond milk will be given.
mhm,
Okay. Then again, like because of the food is okay, but the parents actually, when we tell them, they try to accommodate as much as they can, and
okay.
no uncooked food will be given to the child,
Mhm,
no chemical, no use of any soap.
mhm. Dr. Nair, you just mentioned soap, so I really want to add in this question as a supplementary question here as you continue to talk about the dietary restrictions and what can be taken. There is a lot of myths surrounding bath and hygiene routines for children with atopic eczema. What is your recommendation about the hygiene routine? Can they take baths daily, or is there a routine that they have to follow?
The routine they have to follow, but like cleanliness is more important actually. If the child is like oozing a lot, like with the pustules will be there. Pus means that because you won't be able to do anything at that time,
Mhm.
and treatment also can be given when the pus is there, because that is very infectious stage. So we tell them not to give any bath those days actually.
Mhm.
And like during the Panchakarma, then when the child is little better, then we take him for the Panchakarma.
Uh-huh.
Okay,
That
then
is there.
only like because you asked about the bath.
Uh-huh.
Bath in these cases will not be done. Otherwise, if like if there is no lesion means, then the child can take bath.
Now, continuing with our dietary schedule that you were giving about, what they can eat, what they cannot eat. What about sugar and anything sour like tomatoes, or lemons? Is they recommended, or they should cut down on that too?
Lemons actually, because in these cases we will not stop it. Actually, it is good actually,
Hmm.
rich source of vitamin C.
Okay,
But we will always stop sugar actually,
sure.
because sugar is always contraindicated. We have to give tiktagam. Tiktagam means very bitter things on earth.
Oh,
Yeah.
and
Then
what about fried food?
fried food and all they can take actually, because if the digestion is good, they can take it. If the it all depends upon the condition of the child.
Okay.
Okay, the health we have to see how the child is, whether the child is eating properly, whether his bowel movements are good, whether
Mhm.
he is behaving normally. Some, because they become like they don't eat much actually
Mhm.
because of this itching. Vata aggravation means they are a very poor eater at that time,
Oh,
and digestion also will be very bad. So they are like very feeble actually. They are like tired always.
mhm.
So in this condition, we tell the parents to make soups and all and give them.
Okay. So the
Yeah.
nutrition has to go in along with the healing, and some of the foods have to be restricted and some have to be increased. And we're talking about Ayurveda, where everything is natural and more of, whatever natural can be given. So I think processed foods, even if the child is too much excited about fried and outside food, the parents have to cut that down until the healing is completely happening. What
We
about the
will
other? Sorry,
we will never allow them to give any processed food actually.
processed foods.
Only home cooked food.
Only home cooked food.
Yeah.
Thank you on that input about dietary restrictions. What about exercise and routine? Because when you're talking about young children, as young as, maybe toddlers or maybe children less than age of 5 years, they are very active, they are exploring, they're constantly tired, they're running around. So what is the activities that you encourage them to do, or you say that during the treatment they have to take more rest?
No, there is no restriction like that. If the child is active, let the child be active. Otherwise, if I tell them not to move around, of course, if the bleeding is there, the child will not be allowed to move around a lot.
Hmm.
That's all. Otherwise, we
So
don't pose any, restrictions like that. But itching, the itching will be there. That is there.
Itching brings a
Yeah.
lot of discomfort for everybody,
Yeah.
including the child. Starts with the child and everybody around them. So,
That
any lotions, creams, or oils that would you recommend for them to
oils,
apply?
oils are there. Oils are there. Very good
Mhm,
oils. According to the type of that, like if we have Chitrakadi oil is there, Eladi oil is there,
mhm,
Dineshavali oil is there. There are so many types of oil. Nalpamaradi is there.
mhm,
Because this is all according to the condition we will give them.
mhm,
Okay. And another thing, like if the food restriction also, we will be telling them what they should eat,
mhm.
what they should add more to the diet.
Okay.
Patola. Patola means snake guard.
Oh, okay.
Okay.
Potluck,
So
I
that
we
is
call
a
it.
that, that is a very good medicine actually. Okay. And that is given. And even moringa,
Mm-hmm,
neem.
mm-hmm,
So we give them, and even turmeric.
mm-hmm.
So we tell them, buy the Kerala's favorite, snake guard,
Uh-huh.
cook at home.
Okay.
In whichever way they like, they can make soups because it is very nice actually. Patola. Patola
Patola.
really helps a lot.
That is
I
a
know
very important
bitter
information.
gourd,
Even patola, snake gourd is very important for atopic eczema.
not
And
only for ectopic, it's very good for so many other purpose also. Any skin
also,
diseases. Yeah.
Dr. Nair, atopic eczema by itself is a condition that occupies your mind a lot because it's a very, very stressful skin condition. Do parents have to be observant about any subsidiary conditions that develop along with atopic eczema, maybe like asthma, bronchitis, anything which goes hand in hand in correlation?
Eczema and asthma is always very common. Together only it comes. But like because as the days goes, some days, like by the age of 12, some children are totally out from this eczema.
Mhm.
This atopic normally goes away. But after 12, if it is there, means it will always prevail for a long time. And even in their elder, like in their adolescence, even in their, like later ages also, you can see that they suffer like that.
So, in Ayurveda, eczema can be treated through dietary changes, natural remedies, and also through purification methods at Santhigram group of companies. You can definitely approach Dr. Ambika Nair and her team to understand how to deal with atopic eczema, especially if your children are affected by it. Dr. Nair, we have this constant question which comes in to understand what is the cost of treatment. Does Ayurveda also accept insurance?
See, we tried a lot for, like helping everybody,
Mhm,
but unfortunately, they did not accept it in the proper way.
mhm,
We lost a lot of money, that's all.
mhm.
Okay, but another thing, that HSA, health saving account, and we give them bill. We have all the code, everything, and we give them proper bill actually.
Mhm.
So if anybody needs the bill and if they can get it, we can give them a code. They can fight for that actually. So many people are getting, but I will not tell that I will get them the insurance. I can give them the bill with the code, proper code, because we have everything.
So that can get reimbursed instead of the
Yeah,
insurance part.
HSA they are getting reimbursed, but some companies because if according to the insurance it is not the.
Dr. Naya, the most favorite part of this entire show for most of our viewers is home remedies. I'm sure parents are looking forward to hear from you. Is there something that they can do from home which you would suggest?
Yeah, actually, like even if the child is having so much of itching and all, and if it is infected also, you can take like Triphala. Triphala is available everywhere.
Mhm,
Okay, you can take Triphala and you can make a kashayam decoction and wash that wound. And even Khadira is also available. Khadira can also be used for that. It will help the child a lot actually.
mhm.
Because some days you are unable to come, your finance is not good, you cannot come. But any help that you can, if you need any help, you are welcome to ask me. There is nothing like that. I will not restrict my advice to anybody by telling that because you have to come to me specially. But certain cases it will be very difficult, also very chronic cases, very difficult situation. Then I will tell, please come and see me. Okay. So this can be done, Madhavi. I'm there to help.
That is very interesting piece of information that you've given. And during the Corona times, we all are very curious to know what is the process to reach out to Santhigram group of companies. Are your centers open or are you doing virtual consultation?
Actually, our three centers are open now.
Mhm,
one in North Brunswick, one in Oakley Road, and one in He Hotel in Edison,
Mhm.
Ranton Center. But I am giving, see, if you do the COVID test and come, I can give the consultation in person also.
Mhm.
Otherwise, I am giving on Zoom also or video consultation.
Okay.
So you can
Th-
call and you can take an appointment and come for the consultation.
That's wonderful. So the three locations that you mentioned were in New Jersey. So for our viewers who are watching us across the globe, Santhigram Group of Companies is available for Zoom and online consultation also. And of course, the numbers in the website is clearly visible. Dr. Nair, before we wrap up this show, what are your parting words for parents, special advice for parents who are dealing or taking care of children with atopic eczema?
This can be taken care. There is no reason for an anxiety,
Mhm.
because very worst cases, because internally also they give a lot of other medications like like a cortisone and all, because there is no other way what they can get any help.
Mhm.
But through the Ayurveda and your diet and with your care, we can definitely make your child much better. There is no doubt in that.
Thank you so much. Atopic eczema is a very umbrella statement. There are various stages to it, whether you're affected by just a simple rash or through an infected wound. For everything, there is help available at Santhigram Group of Companies. We thank you for your immense feedback for the show, Aware and Care. We look forward to meeting you all along with Dr. Ambika Nair on our next session on Aware and Care. This is Madhi Batula. Thank you. Thank you, Dr. Nair.
Thank you so much, Madhavi.